Welcome to Trenetralaya, and at Trenetralaya we use contact lenses and different varieties of contact lenses. Today we have Mr. Prajjwal Ghosh, our senior optometrist, to tell us about the specialty contact lenses. So what are they? What and where would we use them is what we would like to discuss. So Prajjwal, I'd like to know, what are these specialty contact lenses?
Yes, sir. As the name suggests, these are specially designed contact lenses to cater to some specific needs of the corneal surface of the eye in general, and to give a greater visual comfort to the eye, what conventional contact lenses cannot provide.
So, what are these special contact lenses used for? In which conditions do we use them?
Sir, they are used for a variety of conditions, starting from high degree of refractive error, both in spherical and cylindrical form. We use it in severe dry eye cases, like Steven Johnson's Oaklane and all that. We use in corneal irregularities in severe cases like keratoconus, like post-refractive surgery cases, and also to correct and control myopia, and also to correct near vision in multifocal contact lenses.
So, Prajjwal, we hear about the rigid gas permeable lenses. So where do we use them?
Yes, sir. Rigid gas permeable lenses are formed, and it used to be of PMMA material, but nowadays these are available in imported Boston material, which are very good in terms of carrying oxygen better to the eye or corneal tissues. They are usually used for high degree of astigmatism, keratoconus cases, and Steven Johnson and other dry eye, severe dry eye cases also. To correct it and to give better visual comfort.
So what are these other lenses called scleral lenses? Where do we use them?
Yes, sir. As the name suggests, scleral lens, it actually rests on the scleral tissue or which is adjacent to corneal tissue. So it actually a larger diameter contact lens which totally vaults the cornea or covers the diseased area of the cornea and rests on the adjacent white tissue or the scleral tissue. That is why it is called scleral contact lens. It may be called a device also because it is a specially designed lens which is actually designed to correct severe degree of metropia or refractive error, high astigmatism, very severe dry eye cases like Steven Johnson syndrome, Sjogren syndrome and all that, and also to correct and give better visual comfort for post-refractive surgery or post-corneal graft surgery cases which are not manageable by other contact lenses.
Now, Prajjwal, what we have seen is that orthokeratology has become a very, very important aspect in our armamentarium. So what is this orthokeratology?
Actually, orthokeratology is a newer technology to the market, and it actually not only corrects the myopia and also tries to control the myopia what other lenses cannot do. What we have seen in the research that the peripheral rays or the off-axial rays actually come to focus behind the retina in cases of high myopic kids. To prevent that mechanism and to prevent signaling to the brain to elongate or increase the anterior posterior length, these lenses are used not only to correct myopia, but also it actually retards the myopia, which is an important aspect of the lens. Now these lenses are coming in soft contact lens form also, giving even better comfort to the patient, and these lenses most importantly are US FDA approved also. So these are the utilities of the orthokeratology.
Wonderful. I think orthokeratology is a very important domain in every eye hospital.
Absolutely, sir. It can be used in conjunction with other therapies like atropine and other things, or myopia control spectacles.
Thank you. Another question that comes to my mind is, for our glasses, we use spherical and cylindrical powers. And when somebody is of a presbyopic age, he uses reading glasses as well. So are there any lenses, contact lenses, that can help such patients not to use glasses?
Absolutely, sir. Actually, we have both toric contact lenses as well as multifocal contact lenses in our armamentarium. Toric contact lenses we use when the cylindrical prescription is more than one diopter, and below 2.5, because if it is 2.5 and above, then we usually prefer RGP contact lenses. But more than one diopter of astigmatism can be covered with toric contact lenses, which attains good visual comfort, what usually conventional contact lenses cannot cover. And we have multifocal contact lenses also. People above the age of 40, they have both the distance as well as near power, and these multifocal lenses are very good in giving good vision, both distance as well as near, giving them best possible visual acuity without the dependence of thick spectacles.
So we have contact lenses for toric contact lenses to correct the cylindrical power, and we have multifocal contact lenses to correct even the presbyopic power that people would wear after 40.
Right.
So Prajjwal, what should we take as careful measures when using these contact lenses?
Yes, sir. What we have seen is the success of these specialty contact lenses actually depends on the understanding and visual comfort of the patient. So we use, we dedicate our chair time a lot to actually make them understand how to use them, what to do and what not to do. Starting from insertion and removal, which are slightly different from the conventional lenses, which is very important. Maintaining ocular hygiene and contact lens hygiene is of topmost priority, and also when to use them and how to use them. And a special point to note here, these lenses are not to be worn at night. You cannot sleep with these lenses unless these are orthokeratology lenses for special purpose. So these are the things, and what medicine to be used to keep the eye surface healthy and fresh. These are also to be recommended and mentioned properly. So we dedicate our chair time to make them understand all these things to for a successful contact lens practice.
So Prajjwal, as a last question, I would like to ask you, so these are specialty contact lenses. Do they actually completely get rid of glasses?
No way, sir. Actually, these specialty contact lenses are advised to be worn for 10 to 12 hours a day, depending on their material and the special need of the eye. So we usually recommend them to use it less than 10 to 12 hours a day only. So after the removal of these lenses, when they come back home, eyes also need a little bit of rest. So at that time, they need to fall back on their glasses. So glasses has to be there for backup and to give them to give their eyes a bit of rest.
So for specialty contact lenses, it's very important to know what conditions in which we use these specialty contact lenses, what are the do's and don'ts, how do we care for them, and finally, specialty contact lenses are an important aspect in our armamentarium, which we should use at specific times and for specific situations. So glasses, contact lenses, and also refractive surgery, whenever it comes, they are all important aspects in our eye hospital that we have. Thank you very much from Trenetralaya.
Thank you.